Hi there, I'm Becky Lacey from Solutions 42, and I wanted to take this opportunity to highlight the importance of why you should look at developing champions for infection prevention control within your teams as opposed to just a one-off training session. As a supplier into the healthcare market, every day any of your field staff enter this environment, they are putting themselves at risk, an unseen risk. And it's for this reason we seem to ignore this risk. The healthcare providers recognise this risk and have spent a great deal of time, energy and resources implementing policies to mitigate the risk. And the risk, of course, is to prevent, where reasonable and practical, the spread of microorganisms not visible to the naked eye from person to person. In a hospital environment, its priority is recognised and accepted more readily than in industry because there is a duty of care not to cause more harm to already vulnerable patients. Patients that every one of us may have been or will be in the future. But it's not just the patients at risk, it is the staff, every visitor, every family member, every friend or every external contractor such as your staff. Out of sight, out of mind is not an excuse to ignore this risk, because not only are we at risk, we are also putting others, the staff, and ultimately the patients at risk. If we do not take responsibility and understand the challenge that the hospital environment is under, we will not be able to help them and we will not be able to help ourselves. Why wait for an event to happen, for action to take place? Why not prevent it now? Which is exactly the reason for why infection prevention control teams were implemented in the first place. Prevention is better than cure. Ideally, when an outside contractor works in a healthcare establishment, the infection prevention control team would advise and demonstrate to you what the requirements are. Unfortunately, they don't have enough time and resources, and you might just get a document to read. But how many of us actually read a document? And the most you might receive is a quick overview at a health and safety meeting if you're working through a building or a facilities contractor. But a one-off training is easily forgotten, and one that is not interactive fades into the distance fairly quickly. That's why Gwen and I have launched the IPC Champion Programme. In this instance, we've targeted engineers and technicians that are working on and servicing medical equipment and all equipment within a healthcare environment. But in reality, this can be applied to your whole organisation. Your customers, the people who work in healthcare, also require continual reinforcement of the risks, because after all, we are all just people getting on with our busy lives. But in the environment that they are employed, it's a requirement to demonstrate competency of any training they have received. And in this instance, infection prevention control, there is periodic practice audits carried out on usually every 2-month basis. Myself, having come from the same commercial side and worked in the same environments as you do, not once did I receive any training from the companies I worked with to highlight the risk that I put myself in every day and the risk that I pose to others. Having trained in microbiology and worked within the decontamination areas of healthcare, I probably understood and can see the unforeseen risk, but better than other people probably could. But nonetheless, at no stage has anyone delivered a package to ensure my understanding and my competency. Probably the biggest driver for that was that there was no one out there with the knowledge and the expertise and skills offering this service in the first place, and secondly, the cost of taking people off the road to do it properly. That's why we've developed our Champion programme. We don't want to devalue the subject by just giving a half-day training. Really, it is much more than that. What we'll do for you is to kick the programme off is to deliver a half-day basic training in hand hygiene, recognising and managing the risk in your workplace environment. And this time off the road basically can be tied in with those engineers or sales meetings that we all have in a commercial environment. As part of this, we'll provide a reference manual and DVD for each individual to act as a reminder for them. The really important bit though is then taking one designated person and giving them a further 1.5 days personal training covering the infection prevention control policies and how they integrate into the healthcare engineering governance that you as providers of medical devices will have to comply to. We'll teach them how to undertake hand hygiene audits so they can do the competency-based checks in the field on your staff. And we'll then support them for 52 weeks where they'll be able to contact us on the telephone, through a discussion forum or via a monthly newsletter with an update of information. The healthcare landscape is really changing. We all know that they have to save £20 billion in the UK. And not only are they required to save that, they're also required to maintain and improve the quality of care that they're providing to us as potential patients. So we all know that strong customer relationships will help us win business. But it is in this time, and it's more important now than ever before, that we really do understand the challenges that our healthcare clients face, and we help them by taking responsibility ourselves in this area, and so that we can also demonstrate to them that we're doing our bit for ongoing compliance. This will be a really strong sales and marketing tool if you choose to use it as such, and it really is for those who want to stand out and be the best. This is an exclusive limited programme. We can only accept 10 people. The power to your sales will come from implementing this knowledge. If you just gain one order, your investment in this programme will have cost you nothing. If you reserve your place today, click on the link below this video and we'll contact you to begin our journey together. Infection prevention control is really everybody's business. Take advantage of this unique programme today and watch the new opportunities present themselves for new business. Be safer. I'm Becky Lacey, Solutions 42, over and out.